And now, I'd like to introduce our distinguished guests. Tonight, we are honored to have with us a board-certified obstetrician and gynecologist in Singapore, Dr. Tan Eng Loy of EK and EL Women's Clinic. He completed undergraduate studies and earned his postgraduate qualifications in the National University of Singapore, as well as the Royal College of Obstetricians and Gynecologists in the UK. Experienced and dedicated to providing personalized maternity care, he is a strong advocate for maternal choice and strives to help expectant mothers go through their childbirth experience in a safe, positive, and life-enhancing manner. Our next special guest is the Therapy Room Singapore's principal psychologist, Dr. Geraldine Tan. Dr. Geraldine holds a doctorate in clinical psychology from California and a master's in applied psychology in Singapore. She has more than 2 decades of experience working with individuals with a multitude of psychological problems. Our third guest to complete our panel is very special to us, as she is one of our VIP parents who also supports the advocacy of Project Sidekicks. She's a mother of 2, having one on the way, Mom Vivien Goh. Dr. Tan Eng Loy, Dr. Geraldine Tan, and Mom Vivien Goh are here to take us through the important points of supporting parents during pregnancy and after pregnancy. Welcome, and thank you again for joining us this evening. For our panel discussion, we have a set of questions tackling the significance of this advocacy with 3 calls to action: 3rd trimester prenatal checkups, nearing delivery day, post-pregnancy health and recovery tips. Let's start. For the first one, at Project Sidekicks, we actually promote 3 calls to action for expectant mothers in the 3rd trimester, which are count your baby kicks, sleep on your left side, and do not smoke. So this question is directed to Dr. Tan Eng Loy. Why are these actions significant in ensuring a safe pregnancy? And what else can an expectant mother actually do to reduce the risk of stillbirth and promote their baby's healthy development? Dr. Tan?
Hello, everyone. Well, it's quite a long question, right? And quite a few bits to actually address. But I think essentially there are 4 different parts to address here. And let's address them one by one. So the first thing I think that was mentioned was counting the baby's kicks. So the baby's kicks are movements that help to reassure a mother that her baby is well. And most mothers are actually first aware of baby's movements by about 20 weeks into their pregnancies. The number of movements tend to increase until 32 weeks and then stay about the same. An unwell baby may move less than usual. Sometimes drugs such as strong painkillers or sedatives, smoking, and even alcohol consumption may also affect baby's movements. When baby's movements are reduced, it is important to seek medical attention immediately to assess the baby's well-being. Unfortunately, a mummy's sensation of baby's movements can be very subjective. A mummy who is busy or active may be less aware of baby's movements. As such, the use of baby kick charts or using an app to count kicks is not actually fully supported by evidence. But however, counting baby's kicks can help the mummy be more aware of the baby's individual movement patterns so that she can seek help if there is a change. So that's the first part. Now, the second bit that's mentioned is with regards to sleeping on your left side. Now, there is very, very good evidence to suggest that sleeping on the side, especially during the 3rd trimester of pregnancy, helps to reduce the risk of stillbirth. And the rationale is that when the mummy lies flat on the back, the weight and pressure of the pregnancy itself can actually prevent blood from the lower half of the body from returning to the heart. This results in a decrease in the amount of blood that the heart can pump to the rest of the body, including the pregnant womb, and increasing the risk of stillbirth. Well, traditionally, the advice is for mommy to actually lie on the left side because the large blood vessel involved is actually located slightly to the right of the body. However, the general recommendation these days is that the left or right side doesn't really matter. It is more important for a mommy to start on her side whenever she sleeps. And there's nothing to worry about or to panic if she wakes up on her back in the middle of the night. Just simply roll back to the side and continue sleeping. So that's the second bit. Now, the third bit is quite obvious with regards to smoking. And I guess the majority of us should be already aware that smoking is not healthy, let alone to the unborn, fragile baby. We know that women who smoke have more difficulty getting pregnant in the first place. And when she's pregnant, smoking can actually cause tissue damage in the unborn baby, particularly to the baby's lungs and brain. Smoking is also linked to an increased risk of miscarriage. Mothers who smoke are more likely to experience premature delivery of their babies. 1 out of 5 babies born to mothers who smoke have low birth weight, and these babies are also more likely to die from sudden infant death syndrome. Therefore, not smoking or quitting smoking once a mother gets pregnant is important to ensure a safe pregnancy. So I think the last bit is to basically advise how expectant mothers, what they can do to reduce the risk of stillbirth and to promote their baby's healthy development. I would suggest mummies visit their doctors regularly for their checkups, especially for those who may require additional checkups for complications that may develop, such as gestational diabetes, as these can be linked with an increased risk for stillbirth. It is also important that the mummy gets adequate rest and for her to eat healthily. Most mummies have ready access to their doctors or even to the hospital labor ward, especially in the 3rd trimester. It is important for them to consult someone should there be any doubts and to seek immediate medical attention should they experience reduced baby movements, unusual pain, bleeding, or sudden gush of fluid from their bottoms, which may suggest that the waters may have broken prematurely.
Thank you so much, Dr. Tan. Thank you so much for your response. Moving on, we still have more questions to go. We'll be talking on the topic on the 3rd trimester prenatal checkups next. Again, it will be directed to Dr. Tan. The question is, there are so many checkups during the entire pregnancy journey. So what are the key prenatal tests in the 3rd trimester to ensure that both mother and baby are actually on track? Like, what do you actually normally watch out for that indicates it's a concern?
Okay, so I think most mummies would have actually be on a once-a-month checkup frequency by the time they reach the 3rd trimester. And as the pregnancy nears term, most mummies may be offered more frequent checkups, and it may not be unusual for mummies to be seen weekly or once a fortnight towards the last 4 to 5 weeks of the pregnancy journey. So the doctor will usually ask for symptoms of tummy pain, loss of fluid from the vagina bleeding, and reduced baby movements at each visit. The mummy's blood pressure is also measured and the urine checked for the presence of protein, as a special high blood pressure condition known as preeclampsia can develop commonly in the 3rd trimester. There are some important tests not to miss. For example, the glucose test for gestational diabetes, which usually should have been taken place by the start of the 3rd trimester at about 28 weeks or even earlier. Secondly, an ultrasound scan between about 30 to 32 weeks to ensure that the baby is growing well. And also thirdly, a cotton swab test that may be undertaken between 35 to 37 weeks to assess for infection by a bacteria known as GBS. And mummies who are tested positive for GBS will be recommended antibiotics when they are in labor to lower the risk of infection for the baby at birth. Towards the last few weeks, the doctor may also assess growth and the amniotic fluid levels on ultrasound more frequently, and if necessary, to arrange for a heart tracing called a CTG if there are concerns about the baby's well-being, or if the mummy has gone past the due date but has yet to go into labor. Now, any unusual development or concerns may prompt the doctor to discuss with mummy if there's a need to, as well as to when and how to deliver the baby.
Thank you, Mom Vivien. Okay, for the next question, right, it's actually directed to Dr. Tan Eng Loy and also Dr. Geraldine Tan. How does maternity mental health affect the fetal health and development?
Should I go first? Okay. Well, I mean, it's quite obvious, right, that the mother's mental well-being will certainly affect the baby's health and development. So, I mean, an example is that a mother who is stressed or depressed, she may be less likely to get enough sleep and rest. She may also be prone to under or overeating, and these can certainly directly affect the baby's health and development. And I feel that mummies who may be depressed may also be at higher risk for substance abuse, including smoking and alcohol consumption, and these can certainly affect the baby directly. I think in the extreme of cases, right, obviously we are afraid of mummies who may be so severely affected, right, that depression, that they actually cause self-harm to themselves. They actually have increased risk of self-harm, and in fact, I think in Western society, suicide is commonly identified as one of the leading causes for maternal death. So I think recognizing mothers who are at risk is therefore something that is important for all of us looking after pregnant mothers.
Yeah, just adding on to what Dr. Tan is saying, right? The mother is so vital in the whole development of the fetus, but we're not there to blame her, right? And we want to ensure that the mother enjoys the entire process of pregnancy, which sometimes is not available under certain circumstances. But when we observe, so many times when we have clients that come in, and the parent says, my child has an issue, and we observe the parent. So most of the time we see a very high level of anxiety in the parent. And this, can happen when they're pregnant and continue on. So it follows on and follows through the toddler years, into the primary school years. And the parent continues to be anxious. So imagine the poor parent has been suffering all these years without realizing. Yeah. And what happens is that then this anxiety not only gets transmitted during in vitro, but also later on in the years. So it's really important that we help the parent during this period of time.
I very much agree with you as well. And before we actually move on to our next topic, we have one more question under this third trimester prenatal checkups topic. And this question is actually open for all. The question is, there has been a dramatic rise in stillbirth around the world in the past year. So what is the best way to actually support expectant mothers who are feeling doubly anxious about their health and their babies in the midst of this pandemic? Who would like to go first?
I think first of all, I'm not surprised by the dramatic rise in stillbirths. Whilst not so much the case in Singapore itself, but I think the pandemic itself has certainly resulted in mummies over the world being denied convenient access to maternal health care, in the midst of lockdowns and restrictions. And obviously, I think some prominent cases have been actually publicized in the media. Luckily, I think currently with increasing rates of COVID-19 vaccinations worldwide, including in pregnant women, we are starting to see many societies opening up despite COVID-19, with many of us actually returning to usual activities with the lifting of lockdowns and restrictions. And I think hopefully with this, access to maternal care will be less of an issue. I think what mummies can do is to keep healthy and to stay safe by getting vaccinated when advised to, ensuring that they continue to see their doctors regularly for pregnancy care, and also to take precautions against infections such as maintaining hand hygiene and wearing masks when appropriate. I think these are some of the things that some mummies can actually adopt.
And Dr. Geraldine, do you have anything to add on?
Well, I guess hearing from what Vivien was saying earlier, right? She knows a little bit of information, but she doesn't know exactly or other information that is available. And the whole pregnancy process, it is a miracle, fraught with a lot of anxieties, and no one can tell us 100%. Nothing is 100%. And that leaves us feeling very uncertain. There's so many uncertainties. I think the pandemic compounded this sense of uncertainty. And that is why, so many of these parents or mothers start to feel even more depressed or even more anxious. So helping them to gain control, a little bit more control by prepping them, by giving them a bit more factual information. I know a lot of people that love to offer their opinion or offer, you should do this or you should do that. Now, that's really not helpful. But offering solid advice. So the gynaes are wonderful. A lot of times we anchor upon the doctor to journey with us because they provide us with good information. So a lot of parents also tend to intellectualize. What I say when I say intellectualize, they love to read and scour the internet for many different sources of information. And sometimes the more you search, the more negative the information becomes because the algorithm just throws you that, right? And, you start to panic. You start to be fearful. So perhaps if you have any question, trust your doctor and trust what they tell you and follow what they tell you.
Yes, agree with that. Yes,
I
too
think
much.
to add to that
Yes.
point itself, I think that's a very, very valid point. And I think just now Vivien mentioned that, the doctor, her doctor didn't really discuss too much with her. And sometimes the thing is striking that fine balance that can be very, very tricky. Because we on the one hand want to provide information, but sometimes we do not also want to, overload the patient with information and in the process actually cause more anxiety. There are some patients who say that I do not want to hear any of what you have to say, right? Because I'm just, anxious, right? So sometimes getting that rapport is very, very important, and also establishing, what what the mummy may have to tell you, what the mummy's questions may be. My suggestion to many of the mummies I'm looking after is to basically, I give them plenty of opportunities for questions, but also I do encourage them to write down their questions. If they go home, they forgot to ask something, to write it down so that they, whenever they come to see me the next time round, they can actually ask me again. Right. So I think this to and fro is always important in the mummy and doctor relationship. Overall.
So I think that Mom Vivien also agrees. She was nodding her head away. So for the moms in the audience, I hope you will take down all these pointers, and not be so anxious during your maternity journey. Okay, so now we'll be moving on to the next topic on nearing the delivery day. So for the first question, it will be directed to Dr. Tan Eng Loy. What should expectant mothers monitor or watch out for as they near their delivery day? Like, what are some of the warning signs to actually bear in mind, and what should they avoid doing to ensure their health and safety, and of course, their babies?
Okay, so I think hopefully, by now, most of our audience will be familiar with what I've been kind of trying to drill, right? So I think that trimester, obviously, you want to see your doctor regularly. You want to keep a lookout for symptoms, including decreased baby movements, any unusual pain or bleeding, or loss of fluid from the vagina itself. Now, additionally, if a mother is actually uncertain or feels unwell, such as if she's experiencing blurred vision, seeing spots in her vision, she has headaches, pain in the upper tummy, or unusual swelling in her hands and face, she should actually seek immediate medical attention. The symptoms I've just mentioned are actually symptoms of a severe high blood pressure condition known as preeclampsia, which can be life-threatening for both mother and baby. And generally, a mummy should be able to do what she used to do during her pregnancy. If she has been exercising in pregnancy and is continuing to exercise, then I would advise her to actually start modifying her activity level so that she does not overexert or lose her balance in order to reduce the risk of falls, which can affect both herself and the baby. I think for mummies in the third trimester, it's always important to rest well and to eat well in preparation for the journey of not only just childbirth alone, right, but also parenthood ahead.
Thank you. Okay, for the next question, it's actually open for all. What are some important to-dos as an expectant mother nearing the actually delivery day? Well, Mom Vivien, will you like to go first this time?
Important to do is pack my bag, pack my hospital bag. That's like the main thing that I know I need to do before I deliver.
Yeah.
So I think I'm now around like 36 weeks. So so my important to do is just like making sure everything is ready and just let nature takes its course, and hopefully I can last till 37 weeks at least. His full term. That's all.
And Dr. Geraldine Tan?
Yeah, I suppose that whole checklist is very useful, whether it's for the back, whether it is what to expect. I think many times we go into the labor ward not knowing what to expect in the room itself. So it's also nice to know what it is. So a lot of times, young couples will go in and do the hospital tour, but it's also good to know that whole process, the whole birthing process. It gives you a sense of control also, which sometimes we feel pregnancy we've lost all control. So obtaining it back becomes just that little bit helps a lot. It goes a very long way. For those that have had experiences before that are not so pleasant, what the psychologists or the therapists tend to do is to walk through some of the possible triggers. And that is important because you don't want the parent to have a panic attack whilst giving birth. It's not very common, but it does happen. Or they start to break out in cold sweat. They start to be very irritable. They show all the signs and symptoms of anxiety. So we also want to watch out for that. Walking through with the parents, so it's not just the mother themselves that we walk along and journey with, but the couple. That means both husband and wife, or the mother to be and the father to be also, because both are involved in the entire journey. So I need both to be calm. So many times, if we only focus on one parent, and we forget the other parent, oh my gosh, I think I had fathers who panicked, not knowing what to expect, during the delivery. And then when we walk through it, he goes, "Oh, but can I not cut the umbilical cord? Is it okay?" He was so worried about it. He said, I'm going to faint. And, these can be discussed. These can be spoken about. It's no big shakes. But when they are in the room already, and he doesn't do certain things, or he's made to do certain things, the emotional turmoil that he has to go through, and whilst being overwhelmed by everything else, I think it's a little bit too much. So, just journeying with them over the small, we think it's small, but actually it's not small when in that moment you're experiencing it. So it's really important for us to walk through with them and prepare them, not only the checklist, but the emotional preparation. Whether it is the whole process of it, whether it's the triggers, and sometimes they have certain requests, also a favorite music to be played. Maybe they want total silence. I'm not sure, or they want to eat a certain meal before they deliver. I mean, all these seems trivial, but it adds to the fun of the entire adventure of being that parent, that new parent.
Yes. I think that's a very good advice. Yeah, must
I think having a birth plan. The birth plan is important. Yeah, so I think what Geraldine mentioned, I think, I do encourage the mummies who see me, to actually come up with a birth plan. I mean, not to have another additional checklist in that sense, right? But at least you kind of think through of, the things that you want. I think like what Geraldine mentioned in terms of music that you like to play, or whether you want the room to be in complete silence. I think these are very, very little but very important things that matter to both mummy and daddy, at the point of delivery itself. And also, I need to add to the point, I think for Vivien's case, this is second child, right? Second baby. All right. Don't forget about the older child, right? You need to make some plans, right? Who's going to look after the older child, right? Who's going to be, in charge, who's especially if the child is still pretty young, right? Who's going to sleep with, him or her, right? All these things do matter, especially when you come back with a new baby.
Yeah. I bought a present already. The newborn baby need to give a present to the older child, right?
So for our parents to be in our audience, maybe y'all can start scrolling through your music and see which music you want to play, on the day itself. Right. For our next question, is directed for Dr. Geraldine Tan and also Mom Vivien. So how can we help mothers keep calm and relaxed during the labor and delivery, which I think that you have already earlier touched on a little bit. And the second question is, how do we alleviate the common fears they experience during this period, which probably you have gone through, like using the music. Do you have any other advice for them?
The fears that they have, the common fears, I guess it's really to address them with the doctors, to address them with other mothers also who have gone through perhaps that whole journey, so awareness and knowledge about it helps to calm them a lot already. Keeping calm, I think I hear what Dr. Tan was saying about decreasing or modifying some of the activities, but I suppose things like meditative work or yoga is still possible, right, Dr. Tan? Okay, I see your
Certainly.
yeah. So a lot of times they enjoy, especially the new modern mummies, they're very active and they don't want to just sit around doing nothing. So a little bit of a stretching is perhaps even healthy for them if they can manage it. So don't force yourself if you feel some pain, okay? But for those that love to take a moment for themselves, and also I would always encourage the new parents to have a little meal together, in celebration of that moment. Also, it's a very precious moment, whether it's with the couple or with your first child, your second child, and then just have that little moment just before you go to the hospital, if it's not a last minute sort of delivery. If it's already planned, but you can always have a little celebration, and that helps to liven up the mood and have you look forward to the delivery and not fear it so much.
Thank you. And now we'll be moving on to our next topic, which is the post-pregnancy health and recovery tips. So again, for the first question, it will be directed to Dr. Tan Eng Loy. What should mothers expect on the first day, first week, and first month after pregnancy? Are the guidelines different from how the pregnancy, for how the pregnancy actually ended, whether it's a successful delivery of a live baby, a miscarriage, or a stillbirth?
Well, I guess we are venturing into the territory of what some of us are increasingly calling the fourth trimester. So I think many mummies think that childbirth marks the end of the whole pregnancy journey, when in fact it's actually the first step in a much longer journey of parenthood. So apart from recovering from the process of childbirth physically, I think there are many other things and challenges to expect, such as learning how to feed and how to look after the baby, including dressing them, bathing, cleaning them, and all this while trying to catch some sleep in between, all right, which can be sometimes a shocker for first-time mummies, and even for second-time or third-time mummies, right? It gets increasingly more challenging. But I think luckily for most mummies, I think this journey can be usually undertaken along with help from other members in the family. I think daddy, sometimes, even, granny, right? And even mother-in-law for the mummy itself. And so goes the saying that it takes, literally a village to actually raise a child. So I think this can be shared out, the burden can be shared out. So I think that's important. Now, of course, the approach will be different on, how the pregnancy might have actually ended itself. So it will be different. And they will certainly, with grief issues in cases of miscarriage and stillbirth, which are unexpected. And in these kind of cases, I think the relevant emotional support and the need and respect for the mummy's privacy may need to be addressed in many of these cases. Whatever the cause of the miscarriage or stillbirth, it is also important for us to actually discuss with the parents if there was any cause identified, so that we can actually plan for and to avoid a similar recurrence for future pregnancies. So I guess the way the pregnancy has ended would obviously influence how we're going to address the needs of these mothers.
Agree. So the most important thing here is for them to actually speak up about it, to actually talk about the reason as to, yeah, I do agree with what you said. Okay, for our next question. Sorry, Dr. Tan?
I think that given mummies in these kind of situations, giving them a chance to actually vent out, their thoughts and all that will be certainly very, very important as part of the process of recovery.
Agree. Yes. Great. So for the next question, it will be for all. What is the ample period for a mother to recover after a pregnancy? Like, what are the important tips to follow to ensure that her physical health and mental, emotional well-being are actually well taken care of? Yeah.
I mean, if we are looking at the different ways the pregnancy ends, it would be different time for different moms. So it wouldn't be the same. In any case, for different people, it would already require different time periods. So it's not a one size fit all. It usually information that is out there is actually for a guide. It's just a guideline. but it is not gospel truth. It's not carved in stone. So certain moms, would require a little bit more time to recover physically. But I think Dr. Tan can cover the physical part. I will look at the emotional part. So some parents, new parents, they thought that they can fall into parenthood quite quickly. And then they realize, oh no, I'm very overwhelmed. I don't know what to do. Um, or postnatal depression hits them, and emotionally it takes longer to recover. So all these factor into the consideration of how long it takes also. So really we can't say snap out of it. We can't say you should feel happy, or you should feel blessed that you have a new little kid, or so these words will not help. So that's in a normal pregnancy. And if, let's say, there is grieving involved, we know a parent's grief will not end. But we know the intensity can taper off after a period of time. However, many times when someone loses, or a parent loses the child, whether it's a miscarriage or a stillborn, they may not have told everyone about the pregnancy. So this baby suddenly is not celebrated anywhere except by the couple themselves. So who do they turn to? Who do they talk to? It becomes a very lonely journey. Recovery becomes longer. The emotional recovery becomes longer. Even the social recovery may be prolonged. Social recovery where they feel the ability to connect with another person, to celebrate another life born. So some of them find it very difficult also. My friend is pregnant, but I cannot feel happy for my friend, and they feel guilty on top of feeling bad for their own loss, or grieving for themselves. Yeah, so these are things that sometimes are unspoken, unseen, unheard, and these would contribute to how long the parent would then take to then feel better about the entire situation.
Yeah, so it's important to give it some time, yeah? Great. And Dr. Tan Eng Loy, do you have anything to add on?
I think that's a lot of the emotional aspects. I mean, physically, in terms of recovery, the medical definition is usually 6 weeks after the delivery. All right. But of course, some mummies may take a bit longer to actually do so. I think common problems that many mummies face after, especially a natural birth, is actually that of incontinence issues. And we do tell our mummies, who experience this symptom, to basically do their pelvic floor exercises. But it may take about 3 months for them to actually recover. All right. And obviously, the body changes a lot, all right, after pregnancy. All right. 6 weeks is not a very, very short time, but neither is it very, very long as well. All right. So the body is supposed to kind of return to its pre-pregnant state. Obviously, there are some changes that may actually last, even months after the delivery itself. Right. So I think, as what Geraldine said, a lot of it, is really up to the individual. Right. Different people, different. There's no one size fits all for everyone. All right. I mean, on our part, as medical professionals, when you look after mummies, the postpartum check is usually 6 weeks. So this is a point where we try to, touch base with them to find out how they're coping in terms of the physical side of things. Emotionally, we sometimes do ask them how are they coping with the newborn. All right. And this is where sometimes we may get our colleagues, psychiatrists or psychologists, right, to address some of the issues, some of the concerns which they may have. Right. We usually use that 6-week appointment also as an opportunity to actually reinforce the health of these families. Right. So the routine thing that we'll do is to offer a pap smear for cervical cancer screening. For mummies who are diabetic in their pregnancy, we will usually offer them also a repeat check to make sure that the diabetes have gone away, and also to provide advice, right, with regards to prevention of longer term diabetes. Right? So I think these are some of the things that we would usually advocate for our patients.
We'll be opening up the discussion to answer some questions from our viewers. Okay, hold on here. Let's see. We have some questions from our viewers. Okay, can we show it up? Okay, first question. Is there a specific number of kicks that should be counted daily?
I guess this question is addressed to me. Well, actually, in my answer earlier on, I did mention, right, that counting kicks itself, unfortunately, the evidence behind that is very, very little. And but I think the purpose of actually counting kicks is to basically make yourself a little bit more aware. Now, that said, I think many of my colleagues and myself even, we would sometimes, as a general rule of thumb, we will tell our mummies, right, that within the awake hours in the day itself, you should actually expect about 10 movements. Right? If you actually hit that requirement, then you should be okay. Now, the Royal College of ONG in the UK does have a more specific kind of recommendation in that if a mummy says that she's feeling less baby movements, and because this is very, very subjective, right? So they suggest that one of the ways is to be a bit more objective, find yourself a quiet place, free yourself of distractions, lie on your left side so that the circulation is good for your baby, and then focus on counting alone, right? And the general advice is that within 2 hours, you would expect at least 10 movements, right? Failing which you should then, call your doctor or go to the hospital to seek medical attention. So I think that's a general rule of thumb. And I think many apps that are available. I think probably the app that's provided by the Asian Parent will also probably have some similar recommendations as well.
Thank you. Okay, so do we have a second question? All right. What can I do to relieve my third trimester aches and pains?
I guess I'm going to take that question as well. All right. Now, aches and pains are very, very common. I think the mechanical nature of the pregnancy itself. The additional thing that mummies may sometimes experience is that their ligaments and their joints start to loosen to prepare for childbirth. All right. So now, unfortunately, I think many of the strong painkillers that are available are not so safe in the third trimester. Right. For those who are not allergic, I would normally recommend safest painkiller would be that of paracetamol or Panadol. Right. Some of the rubs, the ointments and all that can be actually applied quite safely. So these are some of the things that I may recommend. Other things that I may sometimes recommend to my mummies would be, simple things like, adopting good posture, looking after their backs, even simple things like using a hot pack, right? Or sometimes seeking some professional opinion from a physiotherapist may be of use for these kind of symptoms.
Thank you. Okay, and now due to the time constraint, we will have one more question. Yeah. All right. Sorry. Is there any difference sleeping on the left versus the right side?
Yeah, so I think I did mention this earlier on. So the advice that's been given traditionally is actually to lie on the left side, and the belief is because the large blood vessel that returns blood back to the heart is actually slightly more on the right side of the body compared to the left side, right? But that said, I think there's a campaign on sleeping on your side. I think if you do a search on #sleep on your side, you'll find lots of it, right? Even in the UK and New Zealand, I think they do suggest that left or right doesn't really matter. Right, just start, be it a nap or, at night you're going to sleep, just start on the side, right? And then the thing to reassure is that, if you wake up in the middle of the night and you realize that you're flat on your back, not to panic, not to worry, right? Just go back to your side and continue sleeping after that.
Okay, again, thank you so much. Yes. Okay, again, thank you so much, Dr. Tan Eng Loy, Dr. Geraldine Tan, and Mom Vivien Goh for sharing with us your expertise and also your advice and supporting us in this second round of Project Sidekicks. With that said, before we actually call it a night, if you may, please give us your closing statement. Maybe we can have Dr. Tan Eng Loy to go first.
I think basically, well, closing statement, we said quite a fair bit, but I think the reinforcement is basically, attend regular checkups, right? Seek attention, seek help, right? If you feel that the baby is not moving well, right? And keep healthy and stay safe, right? And be prepared, basically.
And Geraldine Tan?
Yes, I always feel that, pregnancy is an adventure. Well, life is always an adventure, and this is the greatest adventure of all. So, if we just take that little bit of excitement and go with it, excitement and fear have the same physiological changes in the body. So if we try to change fear into excitement, we would enjoy this journey a little bit more.
Okay. For me, I think when you're pregnant, the most important thing is to be happy. So I think being happy is the the most important thing. When you're happy, I feel like the kid, like when they are delivered, they will be happy as well. When you are stressed, your baby come out, they'll be very stressed. So I feel like the most important thing is just to be happy, don't be anxious, and just do whatever that makes you happy. But of course, like think of the health, like always be like make sure like they're healthy as well. Yeah. Thank you.
Okay, and with that, we would like to thank everybody who joined us this evening and sat through our talk. We hope you had an informative and insightful evening with us. Please visit our website, project-sidekicks.com, to join our cause and sign up as a partner or as an ambassador. Thank you once again, and good night.